you're looking for a provider and you just want to make sure that you are going to a safe provider who can give you the care that you need, and you're wondering, can my medical esthetician give me Botox? We're going to talk about it today. We're going to talk about the United States. There are other places in the world that have other rules and regulations. So I am a US-based physician, and so the answers that I'm giving you are really specific to the United States. And I will also say that every state has certain little differences between them. So this is the overall just information that you should know from the US, from the vast majority of states, and the way that we feel about prescription medication and the way that prescription medication should be safely delivered to a patient. So I'm going to say this, RN or above, in terms of anyone who gives you Botox or administers Botox to you. Let's get into this. Who am I? My name is Dr. Lynn Neiman. I am a board-certified anesthesiologist, but also I am a medical aesthetics provider and physician. I own and operate Blossom Medical in Northern Virginia, where I take care of patients and I help people feel like how they feel on the inside reflects how they feel on the outside. And it is a great privilege and really the joy of my life to be able to do that job and to be in that profession. Since I have this opportunity to talk to you today, I hope that the information that we share also helps you look and feel your absolute best and gives you the information that you need to make great decisions in terms of any aesthetic treatment that you choose to take on in the future. Medical estheticians have a training that is really radically different than anybody who goes through nursing school or who goes through PA school, becomes a nurse practitioner, becomes a physician. It is radically and vastly different. And although our medical estheticians, and my medical esthetician at my own practice, Tracy, I will say her by name, is she is an angel from heaven, and we all love her, and she knows her skincare ingredients inside and out and can absolutely make a wonderful skincare plan for someone to really radically transform their skin using Zeo Health, Skin Health. We still have products within our Zeo Skin Health, our hydroquinone and our Complex A, that are medical grade products that I still prescribe to a patient, even when Tracy has made up their whole skincare routine. When we get to those prescription grade ingredients, that is a conversation Tracy and I have together, and I actually will prescribe those to a patient, because that relationship has to happen in order for our patients to have safety, efficacy, follow-up, and also somebody who is medically being responsible for any outcomes that that patient might have, or any concerns that that patient might have in terms of their reactions or responses to that medication that may require a physician to either make adjustments or may require a physician to help with any side effects or anything else that happens with those medications. So it's critically important that that relationship is intact and in place. And that's the way that we work things at Blossom Medical. Medical estheticians do not have the power in the United States to prescribe a medication. They also do not have the power in the United States to administer a prescription medication. So what I mean by that is Botox is a prescription medication. You can't walk into the store like you could if you wanted to pick up Motrin or Tylenol. You can't walk into the store and purchase Botox, right? You can walk into the store and pick up vitamin C. You can walk into the store and pick up retinol. You can walk into the store and pick up product with hyaluronic acid. Those are skincare ingredients that we've said are safe. So my medical esthetician can offer you those products. Again, she can use those products, but she can't write you a prescription for an antibiotic. She can't write you a prescription for Botox. That has to come from somebody who has a medical background, whether it's a PA, a nurse practitioner, or a physician. My registered nurses can administer medications. They do it all day long inside the hospital, inside clinics, giving vaccines, giving medications at the bedside, managing. My ICU nurses manage a wall full of really critically important just cardiovascular drips and medications to keep people alive. These are people who know how to and been trained. They are highly specialized and trained to administer medications to patients. So with that background comes not only the ability, but the responsibility to administer Botox to a patient. So sitting in your shoes, I would want a registered nurse or a higher degree to administer Botox and that treatment to me. And the medical esthetician should not be administering a Botox treatment to a patient. And in the United States, that's widely acceptable practice, that registered nurse or a higher degree is able to administer Botox. But a medical esthetician should not be administering a Botox treatment to a patient. I hope that's information that's helpful for you, because I care about your safety and I care that you are making sure that you are seeing providers who are going to give you the best possible treatment, be able to manage you in kind of that 360. So not only do a treatment, but also make sure that that treatment is well done, but also manage any complications of that treatment. And that has to be in the purview of people with a just distinct medical background. I hope that that helps you make smart choices in the providers that you choose. If you happen to be in the Northern Virginia area, I would love to see you as a patient at Blossom Medical. And if you fell in love with my description of Tracy, she literally is an angel from heaven. And she actually does online skincare consultations and really helps people achieve amazing results using Zeo Skin Health. And when we do have to bump up to those prescription medications, that is something that Tracy and I do in concert so that we can give you really total 360 care, making sure that we are offering the best, most efficacious skincare regimens for you. If you would like a skincare consultation with Tracy, you can find the link below. And if this was at all helpful for you, or you're just interested in learning more about me or Blossom Medical, like and subscribe here. Maybe share this with a friend who is thinking about getting a Botox treatment and helping to find a good provider and just knowing even where to start, where to look. Hopefully this will help you. And I'm so really just thankful that you tuned in to listen to this video today. And hopefully you appreciate the fact that I'm trying to keep you safe. I absolutely look forward to seeing you here next time, and I hope you have a great day.